Surgery? I can't see if she said it. Did she say surgery?
I said surgery, yes.
Okay, so since you had surgery, then place, I would start first with the wrists, then you can come down into the pelvic area and place those pads. And then after, you're gonna have to do that probably on the lower end, like toward that 15%, just because of the fact that that's an area full of nerves and very tender. And then there's no reason you cannot place those electrodes around the scrotum and or on the penis itself. Just don't put it very high because it's too much sensitivity in that area. But I would spend a lot of time running scar programs and the skin programs, because in that gives lymphatic flow and circulation to that area. And then if you have the resonance, whatever comes up, there could be emotions that are attached to all of this now. There could be hormones, because I'm sure he's on a hormone blocker and things like that. So running the hormone program just to help balance out the way his body's responding to those drugs and or lack of hormones would be very helpful. So I hope that answers your question for you. What program to run for thyroid imbalance? Well, that's a loaded question, because there's a lot of different there's a lot of problems with thyroid issue. It could be hyper, it could be hypo, it could have Hashimoto's disease. Hormones is a good one, because it's a hormone. Throat chakra would be awesome to run if you have that program. Let's see, depending on how your thyroid's impacting you. So if you're super anxious, run programs for anxiety and stress. If it's all fatigue related, hair falling out, things like that, you have your skin and beauty programs for those types of issues. If it's your hair thinning, if it's weight, you got weight issues due to your thyroid, you can run the weight program, run weight under the fitness program. If you have sleeping issues, you're gonna have to run some of those. Depression, anything that's related to those types of moods. Any recommendation for someone with Crohn's, currently on Remicade and has no symptoms, only had the ability to absorb nutrients. All right, so for people with things like Crohn's, celiac disease, IBS, inflammatory bowel disorders. So for you, Sarah, for the person you're talking about, or for yourself, taking Remicade. So now you're on a drug that suppresses your immune system and is pushing down on your inflammatory process. So you're being suppressed in that process. So you have something that's pushing against you. In that piece, that's where your gold cycle programs are going to be very important. You also have large intestine. Let's get into the meridian programs. Connective tissue, because it's your colon. That's part of a connected tissue. Large intestine would be very good if you're having problems with absorption. Your small intestine, fatty degeneration, stomach, spleen, and pancreas would be very important. Also, for someone who's having trouble with any nutritional absorption, that's where this would be a person that I would strongly recommend that they have or get the nutritional program to go with it, because that way you're going to be getting frequencies on very specific nutrients, folic acid, the B vitamins that you need, foods that can support it, because you're not able to eat things in the same way, and you're not able to eat raw with drugs like that, or you shouldn't be eating a lot of raw food with that. Gold cycle for RA also. Yes, I have rheumatoid arthritis and lupus, along with Addison's disease. So pick our autoimmune disease to have fun with. Gold cycle, gold cycle, gold cycle. From there, rheumatoid arthritis, depending on how it's hitting you, depending on the drugs you're on. So if you're on methotrexate, if you're on hydrochloroquine, Cimzia, any of the TNF alpha blockers, any IL-6 blockers, anything that has to do with, prednisone, any of those. Run hormones if you're a woman. Very important to balance, keep your hormones balanced as a woman with autoimmune diseases. Run specifically the joints that you have. So let's say it's your whole hand. Run it through the wrists, feet, run above the ankles, or run it through, that specific area. Rheumatoid arthritis tends to be balanced on both sides, so you have the same joints, right or left. So you're going to have a lot more success by running it through both wrists for your pain in that area. Let's see here. Floaters in your eyes, covered in cataracts, other than eye program. New circulation is important for anyone who has eye problems because you want to get things up into your eyes. You have to remember blood flow's got to get up to you. Of course, the eye program is very important. In this, I would run meridian systems. If you have the chakras, run the chakra because that could be your third eye, maybe information there. Floaters usually have to do with vitreous issues and things like that. So you're going to need lots of fluid, antioxidant support. So you might want to look at your nutritional program on that to see what you're missing, because there's going to be a lot of antioxidants that you're going to need that support your eyes. For the person that has the complex regional pain syndrome, all right, I'm assuming it's going to be probably a lower extremity because it's one, and I'm going to assume it's one-sided. So if let's say it's your ankle, leg, something, you're going to be using the pads on that specific side of the body, above and below. You have to do both of them above. Nerves, run all the programs, all your meridians on nerves, connective tissue, muscles in your fitness program, circulation, as well as the skin programs for lymph. Get that moving. There is a lot of success over time running the nerves. You can also talk to one of your upline people to get more specific in nerve regeneration and programs that can be gotten from people with the time waiver that are very specific to your condition that can help more with neuropathy or other things. I don't know if you had a crushing injury or a surgical issue that created that problem, so it's a little bit more complex than that. What program will work for someone without a spleen? All right. Welcome to my club. No spleen. Run your spleen program on your Healy. You have one. Run it. You don't have a gallbladder? Run the gallbladder program on a regular basis. Spleen can be done in two different ways. So depending on what's going on without someone with a spleen because of your immune system and how you have to be careful, is making sure I would run circulation, run your gold programs, all of them on a regular basis. Let's see here, get proper sleep. Solar plexus chakra would be very important for you. Sacral chakra would be chest because that can affect your thymus. Lung function, make sure you do that component for you. Liver function, all the organs that are surrounding the spleen. Let's see here, nerve meridian would be great. Blood sugar, anything that controls blood sugar because your pancreas is right there. So, that's why you have spleen pancreas to be run. Hormones would be important. You have under energetic balance 1, immune system. Everyone who has problems with their immune system should be running the immune system, whether it doesn't work properly, is suppressed or not. You can also run anyone who's got a lot of digestive issues, run your food sensitivity program or food intolerance programs, especially, people with celiac disease already know you can't have gluten. But there's other complex issues in understanding people with dairy problems and things like that, because you can have epigenetic issues that go along with it. So in those epigenetic issues, there's other specific nutrients that can help support that. The nutritional program, or those are things I would talk to people about more separately because they're too complicated to talk about, and also because of HIPAA in this type of an environment. Any possible programs for individuals with severe hernia pain problem, surgeons waiting for major weight loss and fitness before putting it all back together again. All right, hernia problem. So we have it down, I'm sure, It's going to be below your belly button down in your groin area. So you can run pain programs there, putting it right above it. If it's not too sensitive, above and below. If you're a gentleman, which I'm assuming it is, you have hair there, you might want to shave a little spot of that off. You can also just run it right through your wrists. Now, you can run your muscles program under fitness because that will help support you and help your muscles get the strength and things that they need. Connective tissue, run scar programs. Your situation, the muscle is torn and that tissue is torn. So part of your intestines or testicle or whatever is coming up and out of that into that area. So take it easy. Be careful in that area. You have the weight program, so you can help support yourself with your weight loss that way to help you food intolerances, large intestine. I don't know what you did to create a hernia, if it's just from weight, previous surgeries. Did you lift too many things that were heavy, things like that. So all of those things would play into it. You know how you got into the situation you're in. So look at all of those components and the programs that are on your 𝗙𝗧 device to help you get back in track with that so that you can have your surgery. What programs for cholesterol issues? Heart, circulation, fatty degeneration. Look at your food intolerances. We're obviously not breaking down hormones. If this is a woman, more so than a man, men too, but predominantly more in women, hormones. Your body will increases cholesterol in order to make up for hormones. So if you're getting up a little bit older, as you're getting into perimenopause and stuff, those are the things that the body does in order to, it's a compensation to help create the hormones that you need. So those would be good things to run. Let's see here, what else would be good? Heart chakra, liver function, as that's another area that is impacted by that. For the person who has Hashimoto's, is that what we have is Hashimoto's? No, we got a thyroid with more hypothyroidism, vertigo or vitiligo, skin issues. All right, so your acid, for the acid reflux stomach issues, obviously stomach, gallbladder, liver are very important. Fatty degeneration. Then when you get into, excuse me, where you have hyperthyroidism, as you're working on Graves' disease, I'd be curious if you have a resonance and it comes up with anything that's localized in your jaw. That would talk about a signaling issue. But you have a thyroid program, run it. Doesn't matter whether it's hyper or hypo. So, okay, sister has the hernia. All right, so it's your sister. So either she's had a bunch of surgeries before, childbirth, C-section, something like that for her hernia. So they're, it's like in that situation for her. Same thing applies. You just don't have to worry about testicles or shaving so much in that area because that's not your problem. It's probably going to be a teeny bit higher. So can you run 𝗙𝗧 with a pacemaker? No. I have to be flat with that. You can vibrate someone with a pacemaker, but you can't run it on you physically. Programs for chronic Epstein-Barr, Lyme viruses, etc. Oh, that's loaded. All right, so for people who have, I'm just going to make it a little bit simpler because these are the type of patients I work on every day. So we're just going to call this chronic secondary conditions, disease processes. So you would run for those types of problems under bioenergetic balance 1, allergies and cold, immune system. Bioenergetic 2, balance 2, bacteria, tonsils, liver function. Can run lung function if you're having problems with shortness of breath, those types of things. You might want to look at some of the mental balancing, inner strength, emotional well-being. Look at hormonal type problems, nerve meridian. For people who have really, who actually have a lot of those issues, and after they've run through a lot of these types of programs, depending on what medications you're taking and the protocols, and we get into whether or not you have heavy metal toxicity, blah, 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 and get, really involved in that. There are specific frequencies that can be gotten through a TAN advisor that can help you with that. Some of those things you want to have somebody monitoring with you. Epstein-Barr has a chance of being able to relapse and come back and bite you in your ass on that one. So hepatitis, depends on which hepatitis you have. You have bacteria in your system already. You can run the immune, which is going to support a lot more of your viral hepatitis. You have the liver. You can run spleen and pancreas with that. You can run organ meridian, so you get all the organs working. And then also it depends on if you have problems with skin issues or many other problems. Let's see here. There's somebody who's kept coming through. So it's chronic pain. Someone had put in, chronic back pain with disc degeneration and disc spurs. Yuck. All right. If there's been, so that's obviously a surgical situation generally for most people, but muscles need to be run on that so you can relax muscles, nerve meridian, connective tissue, place it on both sides of the spine, not on the spine. You want to be approximately 2 finger widths away from your spine, your actual spine itself, for the discs that are bothering you and that are degenerating. Hydration status for discs are very important. They're actually like little sponges. They do like to be given good fats and good hydration. You can run joints. Your spine is part of a joint program. You can look at skin in that area for like maybe the elasticity for lymphatic flow to get fluid away from there. You can run circulation on that. You can run scars on that one specifically. That would be very beneficial. Anything for tension, to release the body, relaxation, sleeping, flexibility would be another one that I would run for a back issue. Can pregnant women use Healy? They can use Healy, but not directly on you. You can have it vibrated to you, but you can't connect on you and run those programs. Dizziness and eye issues combined. Depends on, do you have vertigo, something else going on, but in general for eye issues with dizziness, most of the time flexibility, relaxation in the neck, run a throat program, making sure that this upper area here is open. Circulation, you want to get that up into your head. Eye programs, very important. You can look at skin programs to see if anything comes up in that area. Most of the time you need antioxidant support with all of that. It could be fatigue. You could be overworking your brain. So it really, those are loaded questions, so it takes a lot more. Do you know of anyone using the Healy while giving birth so we don't have to have an epidural? Personally, no. Is it possible? Yes, but you'd have to have a doctor that would be willing to allow, or a doula that's allowed to, is going to be watching this and is going to allow that to happen. And then that would be something I would talk to that person very specifically about. But that is not for this format. Mild cognitive impairments, please. All right, so if you have a mild cognitive impairment, doesn't matter, we can go mild, OCD, severe depressions, learning issues, all of that stuff. So most of the learning programs are supposed to be on the ears. We don't have that here in the country, so put it behind the ears to run, or on the back of the neck. And you have many programs for learning. So is it an acute situation? Are we working on memory, concentration? So you would pick what you're trying to do. I've run it on my daughter for exam anxiety before. That worked very well. Stress. So stress is a big deal for some people with brain function, being able to concentrate, think. Circulation is important. Can't go over that enough, that circulation is very important. Positive thoughts would be another thing for helping those types of impairments. Your GOLD programs, of course, are, or mental balancing would be very important in those issues. Trying to see here, what else we have for crown chakra, third eye, all of those. Brain tumor, you're a person that would be someone I would speak to very specifically outside of, because I need to know if it's a glioma or the type of brain tumor that you have. But if you have a resonance, whatever comes up is what you need. And those would be the frequencies that would be worked on. Your immune system, of course, can always be worked on for that. Anything that has to do with supporting relaxing, releasing this would be a GOLD cycle person, and this would also be someone I would be working on in the, when you get into the deep cycle stuff. Oh, how did we get this on here? Stop. Okay. And then things that support where the brain tumor is. Program to lower blood pressure, heart circulation. How effective are frequencies when they are vibrated versus receiving them directly? They're very powerful in vibrating, but when you have certain things going on, I recommend you put it directly on you for that to work. But do not underestimate the power of vibrating something. It's just you're getting a lot more messages at one time, where if you're actually putting it on you, you're doing something very specific and it's only one thing and we're concentrating on that particular thing. How often does a program need to be run to be effective, especially with multiple issues to address? Multiple times. If you have a resonance, it's going to be whatever comes up. You'll notice that when you have a lot of chronic issues, you're going to have the same things coming up. So if you keep getting GOLD cycle, GOLD cycle, GOLD cycle in your top 1, 2, or 3, then you know that's where you need to be concentrating. As those start to clear and go down, there's going to be other programs in the priority. So you're going to sit there and think, I bought this device because my shoulder hurts. Next thing you know, gallbladder comes up. And you're like, well, that has nothing to do with my pain or my issue in my shoulder. It very well can be, and that could also be why it's being run on meridians instead. So it's a different way of addressing something and looking at it. We all bought our Healy device for a specific reason, but you're going to be surprised at what actually comes up with you. If you don't have the ability where you don't have a resonance, then this is where you need to really understand the condition you have, or find somebody in your upline somewhere who has a resonance and can run some programs for you and help pointing you in a direction to give you some support, or you can always upgrade the device you have. So varicose veins, please. That's a circulation issue. Those are valve issues. There's a lot of edema involved with people who have varicose veins. So I wouldn't be surprised. Heart, circulation. Lymph would be the most important ones there. When you run a program without the cables, how high of a percentage should you use? Should you run it at 100% or less of a percentage? So if you're talking about running it on a vibrate, I vibrate it as high as I can. So it just comes into the preference of what you want. I just send it full strength to what I'm sending it to without any problems with that. Lung cancer. All right, so depending on what type, large cell, small cell, are you on an immune therapy? Are you running chemotherapy? So these were those things where you get into a ton of issues trying to talk about a subject. But in general, obviously lung cancer affects your breathing, it affects your immune system. So you have 2 programs right there to run: liver, digestive stuff, all the support. If you've had lung cancer for a while, depending on what treatment you're having, if you're having digestive issues, or lack of appetite. Those are programs that can be run to help support you. Anything to do with your digestive system, lymphatic system. Most of the time, lung cancer will metastasize to the liver, the head, and to the bones. So anything that can support those areas are going to help you the most. Have you ever heard of lipedema? Ideas, lots of swelling. Yes, I have. You have all kinds of lymphatic programs and skin programs, also run liver programs to support because any fluids, and your kidneys. It's imperative for anyone who has edema issues, lymphedema, any of that, or excess lipid problems, run your kidneys because that is where your body excretes that from, and support that there. Program for toothache with nerve affected by wisdom tooth. Put it right where, put them right here. Put them right where the tooth is that's affected on your nerve. You actually have one of the programs that specifically states for tooth nerve pain. So that would be the second one, local jaw, your tooth jaw local, and place the actual pads right on where your jaw TMJ is right here, and run it. Or for one side there, run it underneath. Or you can put it, I would go below the neck, not on the jaw, because the pain from that area runs down and that nerve goes this way. So I would be running it, more on my jaw and on the muscle, your sternocleidomastoid muscle, and placing it there because that's where the nerve is. Chronic UTI for 70-ish-year-old woman. Doctors can't find issue and she has no gallbladder. Bacteria for that. Bladder meridian, kidney meridian, lymphatic system. If they've cultured it, does she have an E. coli infection, or is it something else? It could be pH in your system, so hydrate, hydrate, hydrate. Can you run Healy on a person with blood thinners? Yes, you can, but please pay attention if you're bruising and stuff. These are very powerful tools. My mom's been on blood thinners for many years because of an autoimmune condition that requires it. They just had to lower all her medication because she's been running Healy for about 3 weeks now. So her Coumadin had to be reduced dramatically. What programs can someone use with colon cancer in treatment? All supporting programs for someone undergoing cancer treatment. If assuming they've had surgery, so scars, large intestine would be very good to run. The skin elasticity so that you have lymphatic flow, your wounds locally for that area. You can do more systemic due to that. You can run immune system support. This would be very important that person has a lot of the gold supporting programs being run. It would be very gentle with a person like this, more support. So I wouldn't be doing a lot of releasing. And I would also be running a lot of programs for mental health in this situation. Having cancer is scary. Having cancer treatments depletes you, can make you depressed, things like that. So those would be the programs that I would work. It doesn't matter whether it's colon cancer or if it's some other type of cancer. We would just change some of the meridians or organ systems based on that. What could help for frequent tics, spasticity, movement, side effects for taking Zoloft? Friend will be running depression to get her daughter off meds, but wants to help with the tics in the meantime. Nerve meridian, liver meridian, making sure, who knows how much this drug is impacting her nervous system or detoxing system. So that nerve meridian is very important. Her liver meridian is very important. When you get into meridian 1, connective tissue, skin, I would run well-being of soul for this person. Contentment, acute would be very important for this person since it's a young person. Under bioenergetic balance 1, nerves, be very important for her. Hormones would be important because she's young also, and that could be playing a big role in this. Kidney meridian, organs, and then, like I said, we would be spending a lot of time on the gold cycle. What about post-stroke spasticity? Spasticity of any type, muscle, nerve, connective tissue, lymphatics, kidneys. Those are very important for that, for someone who's had a stroke with a lot of spasticity. But you can also run programs on emotions. Relaxation, relaxation, relaxation of any kind is most important. Child with major OCD sees bugs, germs, heightened at nighttime. Obviously, any of the mental health programs are going to work. People who have OCD problems generally have an overactive, like the brain is working too hard. So it's all the look under your job and sleep programs for central nervous system issues. So you want to calm the central nervous system down and be able to promote a relaxation. In that, the person who has the spasticity with the stroke, fine flow would also be important. OCD also would be important to do some of the learning programs. Nancy Staub has a question. She is raising her hand. Who is? All right, Nancy Staub, what is your question? Okay.
If someone has had a kidney transplant in the past year, could they use the 𝗙𝗧𝗘𝗏?
Yes, they can, without a problem.
Okay.
No
and they also had diabetes. So, which, well, I'm sure they still have the diabetes, but, and
yeah,
one
sure.
more thing, if someone has, okay, let me think, what's it called? Cellulitis. Cellulitis in her leg, and her leg is like way swollen, and she's been on 2 different, she's on her 2nd course of antibiotics at this point. Would the 𝗙𝗧𝗘𝗏 help her with it? It's an acute thing, so would the 𝗙𝗧𝗘𝗏 help her?
It can, but because cellulitis is a life-threatening condition, obviously if this person has diabetes and stuff, that's a very complex situation, and that only can be handled through emergency medical professionals dealing with that.
Well, she doesn't have the diabetes. The guy with the but I don't know.
A person who has cellulitis has to have, the doctors have to get that under control through surgery, through antibiotics, whatever they're going to do before you can support them on a 𝗙𝗧𝗘𝗏. That's more important.
Okay.
Sarcoidosis. Yes, you can help sarcoidosis. Run the lung program. Fatty degeneration. Be amazed at how lipids and the way that they're stored in those tissues can be impacted by that. So yes, it works very well. And then if you, for conditions like that, I hope you would have the residents so that you can support yourself in many other ways. Interstitial cystitis, kidney, bladder, bladder. Guillain-Barré and Lyme's disease. All of those have to do with central nervous system, all the gold programs for your immune system to help support it. Turn that down, please. That would be the main areas for that. And of course, Lyme's disease, you can run bacteria on your system for yourself, and then however it's impacting you.
Gary, we're at an hour now. Okay. I don't know if you want to wrap it up.
I'll give a few more minutes to wrap up.
So many issues, and I know your time is valuable, and you're giving away it for free right now, so we appreciate that. Thank you very much. I don't know how you want to.
Yeah, I'm willing to give a few more minutes to answer a few more of these questions. Can you overuse 𝗙𝗧𝗘𝗏, run too many programs on a daily basis? Yes, you can, especially if you don't know which ones you're running just because you're running them willy-nilly. It's like, if you're going to run a pure cycle program, as long as it's not release, you can run a couple of those with no problem. But if you run release, run another program, like I said, to balance it, and don't run anything else, because you have to think about what that means. Release, get rid of something in my body. You're going to have a reaction to it. If you're running a problem where you have problems in your gut, like digestive issues and stuff, and you start running it, Well, don't be surprised if all of a sudden you're in the bathroom, or maybe you're feeling a little bit off because your body is releasing something and doing something. How to strengthen heart for someone who had a heart attack before. Exercise, eat properly. You can run the muscle program, the mitochondrial program, things in your list. So circulation, obviously. You can run strength for muscle strength for a person who's had a heart attack. You can run stamina, regeneration. But then there are programs in here, I found them somewhere, that had to do with mitochondria. So I would do toxins for someone who had weak heart because there's toxic load there. But if you run toxins, anyone who runs toxins, don't run a bunch of other programs because you're going to release something with that. Somewhere in the list, it does talk about mitochondrial energy. Those would be programs that I would run if I've had a heart attack. But circulation is going to be very important also, and you also have the heart one. Hand and foot cramps very often, despite well hydrated, plenty of electrolytes, magnesium and potassium. You have flexibility in here. You have lymphatic components you can run. Connective tissue can be done, where you're running the energy for that. Circulation into those areas can help with that. What would you run for swollen feet in a pregnant woman? You can vibrate to a pregnant woman, anything that would have to do with lymph or circulation. Help with smoking for over 40 years, liver and containment, not helping much with my mom, contentment. All right, people who smoke, it's getting, we talked about some of that last week. They have emotional issues. So if she's been smoking for 40 years, think about what smoking does, and not about the physical, but what is the act of smoking? You're sucking something in. You're holding on to something. So release programs would be very important here in that. So what is it that she's always swallowing her emotions down for and kind of holding things in? So there's a ton of underlying issues here with anger and throat chakra issues, feeling, like not being able to speak. She's using it to do something. It's a compensation for something. So nicotine technically within 2 weeks is out of your body. Doesn't, after 3 days, it's pretty much out of your system. Within 30 days, it's completely out of your system. So now it's become a behavioral issue. So what are you doing in that behavior in order to help support that person? So contentment isn't, would be like, that would be one of them, but you want to get into more of what is the releasing, throat chakra, doing a ton of work on her lungs, because that's the area, circulation to bring good blood flow there, but emotions. I'll give you 5 more minutes. What else do we have? Program for phone games addiction. Take a phone away. Anything that has to do with an addiction issue. Sorry, I'm a smart aleck. Addiction is something you're compensating for. What are you lacking in your life? What are you escaping in your life that you have to be addicted to a game on a phone? Who are you avoiding? What are you avoiding? What is it you don't want to see? What is it you don't want to hear? So for someone who is addicted to phone game, playing phone games and things like that, or always on their video systems and stuff, they all have emotional issues, and those are tons of programs that can be run. When you're running those games, it's like it causes hormones to surge in your body, adrenaline, things like that. So those are all the things that you get addicted to. It's the adrenaline. It's those hormones that give you that rush that make you feel good. So we have to let me do a few things here for neuropathy. Anyone who has neuropathy issues, circulation, all your nerve meridians, connective tissue, mud, anything for edema, those types of things will work very well. Alcohol cravings, neurotransmitters, brain, gut. Anything and everything that has to do with depression, anxiety, understanding why do you need alcohol? what made you reach for that in the first place? So you're taking it to do something. You're trying to calm yourself down, numb yourself from something, or feeling better because of something. It's not just, it's an escape of some kind. Those are the things you have to look at because that's what's causing it. And those are going to help with your addiction because it's all part of rebalancing your brain. Canker sores, that's all viral. Run your immune system programs. Throat chakra, tonsils, those have some viral components into it. Ischemic pain for amputation and all toes, excruciating pain. All right, those are those types of pain type things, which are that is a nerve pain. So you want to run, first off, I'd run those programs. So if someone's had an amputation and they're getting excruciating toe pain, or the ischemic pain. So run those from right on the sides, down your shin, right below your knee. Run it from there for those pains. Hit nerve, connective tissue, circulation, lymph, and also run different mental balancing programs because your brain and the nervous system are what's controlling that pain. Mary D is asking about Batten's disease. Anytime you're getting into these rare neurological disorders, all you can do is work within the system and the systems that's involved in where you're having symptoms at for that. Neurological, spinal, those are predominantly the majority of the areas for Batten's disease. I hope you have a residence because it can take you all over the place. I'm sure that there's a lot of emotions involved here. Anything for toenail fungus? Okay, so for toenail fungus, tea tree oil. Let's just make it real simple. Get it up underneath your toe. Get good circulation. Probiotics would be very good. And then you take a probiotic, make a paste out of it, put it on top of that. You're gonna have to do it a lot. Run bacteria and run your immune system. It's a fungus. So it's really hard to get into that, and run circulation because you got to get circulating all the way up into that toenail bed. So,
all right, Yoda. I know you love this. Thank you so much for your time.
We're blessing her right now.
Right.
All right. Thank you. You guys have a great night.
Thank you so much.